What is Tyvaso Treprostinil? Tyvaso Treprostinil is a prescription medication used in adults to treat pulmonary arterial hypertension, PAH, a condition characterized by high blood pressure in the lungs. It helps relax and open the blood vessels that supply the lungs, improving oxygen flow throughout the body and reducing strain on the heart. Tyvaso Treprostinil is available in two forms: an inhalation solution delivered through a nebulizer and a dry powder inhaler, DPI. Both formulations are designed to deliver the medication directly into the lungs for rapid effect. Because Tyvaso Treprostinil requires specialized handling, it is typically dispensed through specialty pharmacies, and your healthcare provider will assist in arranging this process. What is Tyvaso Treprostinil used for? High blood pressure in the lungs, including pulmonary arterial hypertension, PH, pulmonary hypertension from severe lung problems. How Tyvaso Treprostinil works. Tyvaso Treprostinil is a man-made version of prostacyclin, a natural hormone in your body that helps to open up the blood vessels. Tyvaso Treprostinil allows your blood to flow better into the lungs, which lowers the lung blood pressure and helps your body get more oxygen. This leads to less strain on the heart, better ability to exercise, and lower risk of pH getting worse. What are the side effects of Tyvaso Treprostinil? Like many medications, Tyvaso Treprostinil can cause side effects, although not everyone will experience them. Some effects may lessen as your body adjusts to treatment. It's important to talk with your healthcare provider if any symptoms persist or become bothersome. Common side effects. For the Tyvaso Treprostinil nebulizer: cough, 54%. Headache, 41%. Throat pain or irritation, 25%. Nausea, 19%. Flushing, 15%. For the Tyvaso Treprostinil DPI: cough, 35%. Headache, 16%. Shortness of breath or difficulty catching your breath, 8%. Other possible side effects: dizziness, stomach discomfort, pain in the muscles, jaw or bones, fainting. Serious side effects. Seek medical attention immediately if you experience signs of bronchospasm, including tightening of the throat, difficulty breathing or wheezing, chest tightness, persistent cough. Tyvaso Treprostinil is an effective, inhaled treatment option for adults with pulmonary arterial hypertension. It works by improving blood flow to the lungs, helping patients breathe more comfortably and maintain better overall function. Always follow your healthcare provider's instructions carefully, and report any side effects promptly to ensure the safest and most effective use of Tyvaso Treprostinil. Typical dosing for Tyvaso Treprostinil. Tyvaso Treprostinil is available in two formulations: an inhalation solution used with a nebulizer and a dry powder inhaler, DPI. Both forms deliver the medication directly into the lungs to improve breathing and increase oxygen flow. Your healthcare provider will determine which form and dose are right for you. Tyvaso Treprostinil nebulizer. Tyvaso Treprostinil inhalation solution comes in single-use ampoules, each containing 1.74 micrograms of treprostinil. One ampoule provides enough medication for one full day of treatment, regardless of the number of breaths prescribed per session. Treatment is typically taken 4 times a day, about 4 hours apart. The starting dose is usually 3 breaths per treatment session. Your provider will gradually increase your dose every 1 to 2 weeks until you reach a maintenance dose of 9 to 12 breaths per session, depending on your tolerance and clinical response. This gradual increase helps your body adjust to the medication and minimizes potential side effects. Tyvaso Treprostinil DPI dry powder inhaler. Tyvaso Treprostinil DPI is provided in single-dose cartridges for convenient inhalation. The starting dose is typically 116 microgram cartridge, inhaled 4 times daily, about 4 hours apart. Your healthcare provider may raise your dose every 1 to 2 weeks until you reach a maintenance dose of 148 microgram or 64 microgram cartridge, 4 times a day. As with the nebulizer, dosing adjustments depend on your body's response and how well you tolerate treatment. Pharmacist tips for Tyvaso Treprostinil. How to load the Tyvaso Treprostinil DPI. Open the inhaler's mouthpiece. Insert a cartridge into the chamber with the cup facing downward. Align the cartridge tip with the inhaler, then close the mouthpiece until you hear a snap. How to use the Tyvaso Treprostinil DPI. Keep the inhaler level and remove the mouthpiece cover. Exhale fully before inhaling your dose. Place the mouthpiece in your mouth and inhale deeply and steadily. Remove the inhaler from your mouth and hold your breath for several seconds. If your prescribed dose requires more than one cartridge, repeat these steps for each one. Storage and handling. Room temperature. Unopened blister strips expire after 5 weeks. Once opened, use cartridges within 3 days. In the refrigerator. Unopened blister strips remain good until the expiration date printed on the package. Once removed from refrigeration or opened, do not return them to the refrigerator. If cartridges or the mouthpiece have been refrigerated, allow them to sit at room temperature for about 10 minutes before use to prevent condensation from forming inside the inhaler. Discard the used Tyvaso Treprostinil mouthpiece in the regular trash after 1 week of use. Tips for using the Tyvaso Treprostinil nebulizer. The Tyvaso Treprostinil nebulizer delivers inhaled medication directly into the lungs to help manage pulmonary arterial hypertension, PAH. Following each step carefully ensures the medication works effectively and safely. How to set up the Tyvaso Treprostinil nebulizer. Wash and dry your hands thoroughly before handling the device. Fill the white water chamber inside the nebulizer with 45 milliliters of distilled water, ensuring the water level is between the silver sensor and the blue ring. Place a new, empty medicine cup inside the chamber, making sure the tip of the cup is below the water level. This setup helps maintain consistent aerosol delivery and prevents device malfunction. How to load the Tyvaso Treprostinil nebulizer. Take an ampoule of Tyvaso Treprostinil and twist off the cap. Squeeze the ampoule gently to pour all the medication into the medicine cup, and check to confirm it's completely empty. Assemble the mouthpiece, which includes 3 components: the filter, the port, and the opening, according to the manufacturer's instructions. If any Tyvaso Treprostinil comes into contact with your skin, wash the area with water immediately. The medication can cause mild skin irritation. Always replace the filter membrane daily to ensure clean and effective delivery. How to use the Tyvaso Treprostinil nebulizer. Turn on the nebulizer as directed by the manufacturer. Confirm the device is programmed to deliver the exact number of breaths prescribed by your healthcare provider. Follow your provider's instructions for inhaling each dose. Consistency is key. Treatments are typically taken 4 times daily, spaced about 4 hours apart. If you found this information helpful, don't forget to like this video and subscribe to HeInfo, your trusted source for science-backed health education. Stay tuned for more expert insights on medications, treatment options, and tips for living a healthier life. Have questions about Tyvaso Treprostinil? Share them in the comments below. Our team is here to help you learn with confidence.